In December 2019, there was a cluster of pneumonia cases in China. Investigations found that it was caused by a previously unknown virus, now named the 2019 novel coronavirus. Keep in mind that this is a new virus, and what's known about the virus now might change in the future. Coronaviruses are a large group of viruses. They consist of a quart of genetic material surrounded by an envelope with protein spikes. This gives an appearance of a crown, in Latin called corona, and that is how the virus gets its name. There are different types of coronaviruses that cause respiratory and sometimes gastrointestinal symptoms. Respiratory disease can range from the common cold, and in most people the symptoms tend to be mild. However, there are some types of coronaviruses that can cause severe disease. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, and the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012. The 2019 novel coronavirus was first identified in China. It initially occurred in a group of people with pneumonia who's been associated with a seafood and live animal market in the city of Wuhan. The disease has since spread from those who were sick to others, including family members and healthcare staff. There are many cases at present, and the disease has spread within China and also to a number of other countries. So, where did the virus come from? It's known that the coronavirus circulates in a range of animals. Sometimes those viruses can make a jump from animals to humans. That is called a spillover, and could be due to a range of factors such as mutations in the virus or increased contact between humans and animals. For example, SMERS-CoV is known to be transmitted from camels, and the SARS-CoV civet cats, the animal reservoir of the 2019 novel coronavirus, is not known yet. How is it transmitted? The exact dynamics of how the virus is transmitted is yet to be determined. In generally, respiratory viruses are usually transmitted through droplets created when an infected person coughs or sneezes, or through something that has been contaminated with the virus. People most at risk of infection from the novel coronavirus are those in close contact with animals, with such as live animals market workers, and those who are carrying with people infected with the virus, such as family members or healthcare workers. So, how does the disease present? Well, from what is known so far, there could be a number of symptoms ranging from mild to severe. There can be fever and respiratory symptoms such as cough and shortness of breath. In some more severe cases, there have been pneumonia, kidney failure, and death. The mortality rate is not known yet. Now, how can we tell whether someone is infected? The infection can be a diagnosis by a test called PCR, or polymerase chain reaction. This test identifies the virus based on its genetic fingerprints. There's currently no specific medication for the virus, and treatment is supportive care. There currently is no vaccine to protect against the virus treatment, and vaccines are in development. So how do we prevent transmission of the virus? This new virus currently has a limited geographic spread. However, there are a number of standard hygiene practices that have been recommended to protect against the infection and further spread. These include covering your mouth and nose with coughing or sneezing with a medical mask tissue, or flexing the elbow, avoiding close contact with those who were unwell. The appropriate use of masks and personal protective equipment, especially in healthcare settings. Washing hands regularly with soap and water or alcohol-based hand rub. Actions can be taken to prevent infection from an animal's source include avoiding unnecessary unprotected contact with animals, washing hands after contact with animals or animal products, and ensuring that animal products are cooked thoroughly before they are consumed. It is important to stay home if you are feeling unwell, but if you have a fever, cough, and difficult breathing, sick, has to immediately be sought by a medical care. And share your previous travel history with your healthcare provider. That's a quick look at this emergency infectious disease has given that this outbreak is evolving rapidly. What's known about this virus can change, so that we must pay attention for what is coming.